Hello, everyone. My name is John Watts, and tonight we're going to be talking about electronic medical records. And this presentation was actually all prepared by two other people. I would like to acknowledge them. They're my classmates, virtual classmates, I should say. And I hope that I don't damage your name too badly here. But Shannon Mohagan, Georgina Cadero, we're both, all three of us actually, a student at Colorado Christian University, and we were asked by our professor to prepare a presentation on a subject in the healthcare industry, and we chose electronic medical records here. Again, it's been presented by the three of us. I am John Watts. Um, First of all, I want to talk about what is electronic medical records. What is it? It's a digital version of a patient's paper chart. Electronic health information or real-time patient-centered records that make information available instantly and securely to an authorized user. Um, this information contains the patient medical history, diagnosis, medications, treatment plans, immunization dates, allergy, radiology imaging, lab reports, test results. All that information is inside of a patient's electronic medical records. So you know how important that document is. It allows access to evidence-based tools that a provider can use to make decisions about a patient care. There's a lot of advantages of the medical record system. Next, I want to just talk a little bit on slide 4 about the history of the electronic medical record, where it began, where it started. Throw some names out there, some people that kind of helped develop the electronic medical record. It first began as an idea to record patient information on electronic form instead of on paper back in the 60s. That's when the idea kind of was kind of recorded and played around with and kind of begun back in the 60s to take it from paper to some type of electronic form. The first electronic medical record developed in 1972. Larry Wee was instrumental in presenting the concept to generate the electronic record to allow third parties to independently verify diagnosis. So that's just a little bit about the history of the electronic medical records. I'm going to go to slide 5 and talk about a little bit about the components within the electronic medical record. You have the patient scheduling system, their chart or schedule, calendar, when the appointments are. You have patient encounters, everything that the patient encounter or comes into the hospital for each diagnosis. Every patient encounter is also documented in that piece of electronic medical record. You got their drugs. It's a document management system. It requests and receives lab information, clinical decision support for doctors, inter-office communication, patient registration, patient finance, all that. Sorry, not patient financing, but patient registration. All the information are just components you can find within the electronic medical records. I'm going to move on to slide number 6. And number 6, just talk a little bit also about the benefits of the electronic medical record, better known as EMR. You have fewer documentation errors, making patient medical history available to physician, treating them. If you're going to a specialist and you want your medical record from your primary care doctor, this system makes it easier to obtain that record. Hospital and physician office are more efficient. There's so many benefits and advantages on the electronic medical record system, like I mentioned on slide 7 here. Slide 7 just talk a little bit about the advantages of the EMR. The electronic medical records are a digital version of the paper charts in the clinician's office. The EMR contains the patient medical treatment history. It has its advantages over the paperwork. For example, it allows the electronic medical record allows clinician to track data over time, easily identify which patients are due for preventative screening or checkups. It checks how their patients are doing on certain parameters, such as blood pressure reading or vaccinations. Monitors and improve the overall quality care within the practice as well. And those are just some of the advantages of the electronic medical records. I'm going to move on to slide number 8, and it talks a little bit about the focus of the electronic medical record system. It clearly states that the electronic medical record system focuses on the total health of the patient. It's going beyond the standard clinical data collected in the provider's office. It has a broader view of the patient care. The focus primarily is just to focus on the patient care, and this system has allowed and freed up time for the doctor's office and most healthcare practitioners to focus on the care because of the electronic medical records. Like I stated, it's a broader view of the patient care. It's designed to reach out beyond the health organization that originally collects and compiles the information. The ability to share information with other healthcare providers, such as laboratories and specialists, so they contain information from all over the hospital, the facility, about the patient care. And I'm going to move on to slide number 9, and it's just kind of pretty much sums up for me the reason why we have the electronic medical record system. It just frees up time for the doctor to focus more so on the patient care, and also protecting the patient privacy as well. Privacy is, really big when it comes to dealing with electronic medical records. So it frees up the doctor's time so they can pay more attention to their patients. And on the slide number 10, I just list some references just in case you want to research a little bit more about electronic medical records. There's some great resources out there. Great to know about HIPAA, your rights and your privacy. When it comes to electronic medical records in the doctor's office or any healthcare facility. That concludes our presentation on electronic medical record. I want to thank Georgina and also Shannon for their input. Great job this week on the team project. Really appreciate you guys. It was really nice meeting you, and we did a great job. So thank you guys for your participation and helping out as well. Good night, everyone. Like I said, there's some references there. You want to take a look at them. Great information. Please feel free to do so. Thank you.